Welcome to the Dr. Dana Show. Today I want to introduce an amazing star in naturopathic medicine, functional medicine, Brenden Cochran, naturopathic doctor, went to Bastyr University. He also did undergrad in biochem from University of Washington, and he's been on several boards and also has head up a cancer institute. Today we want to find out more about what's going on in medicine today. What are some of the repercussions that we're seeing now with all the pharmaceuticals out there, polypharma, talk about that a little bit, how naturopathic medicine can help you alleviate some of those problems, where the research is going, and then the amazing projects that you're doing with Dr. Anderson. I know you have a lot of things going on now. But my first question to you is, how did you get into this? And how did you even find Bastyr? Because I know when I was looking for a naturopathic school, which I didn't even know I was looking for, I only found two. I found Bastyr and then NUNM, the school I went to, and I figured that's all there was in the whole world. And I figured, okay, I'll try one of them. I mean, but how did you get into this, and why did you do this?
My passion for this medicine actually started because I lost my father when I was 12 years old, and he was 42 years old to melanoma skin cancer.
Really?
And I kind of went through that and saw how poorly medicine was at the time, basically the little tools that they had to offer. And so my mission was basically to either go to med school or as I went through undergrad, and it was actually chemistry focused and then biochem, kind of like the minor-ish focus. I got passionate about biochemistry and also physiology and how things work, how do we get things to change. And I was looking at going to pharmacy school. Well, that was kind of a big mistake because I ran into a few docs that were actually old pharmacists, and they went back to school to become a naturopathic doctor. And they said, "Hey, you gotta change directions here, so you can use everything." At the time when was at the end of my undergrad, I did do some rotations in pharmacy, and retail pharmacy was not a lot of fun. You really didn't use a lot of the chemistry you learned in school. It was more, you get it in, you answer scripts, or you tell a person, where's the toilet paper, or what aisle are you going to for this medication. Hospital pharmacy, compounding pharmacy was a lot of fun, but at the time when I was going through, it was mainly just the hospitals and kind of mild amounts of compounding pharmacy. And I think I wanted more interaction with people. So this doctor kind of helped steer me towards looking in that direction. I just happened to be walking through an alum slash graduate school, conference hall at the University of Washington, and there Bastyr was, and I took some of their brochures and looked a little deeper, and that's what kind of led me to go to naturopathic school.
That's weird because I think a lot of us ended up that way. Just very fortuitous. It's almost like, oh, what's this thing? And that's exactly the first thing I thought. I was like, what? I came across the website. I'm going, wait a minute, what is this? What do they do? Herbs? Oh, okay, I know herbs. I know nutraceuticals. I had my degree in nutrition from Rutgers, and I'd been kind of side on counseling people on vitamins and stuff and myself. But I saw this school, and I'm like, this is a weird place. And then I actually interviewed at Bastyr, and they wanted to make sure that I was really going to go there or I wasn't going to go there. And they were like, I didn't realize they tried to push all your buttons in the interview, and I didn't do well like that. I would have never done well there. So I kind of got angry and I told them off and I walked out, and I was like, man, that's the school I want to go to. They got all the bells and whistles. They got all the grants. And then I went to the National University, or National College, now National University, and they didn't have any of those special things in the grants, and now they do. But back then, there was somebody took me to the library, and he looked at me, and the way he could see, I was type A, hadn't really worked on my spiritual side very much by then. And he said, Dana, it's not the machines and everything that makes the doctor, and that's not what heals people. It's what's right here in the old rare book room and all those old homeopathics and those old guys. And I was changing and going, maybe. So I said, well, I'll interview with both, and I'll get in one. I won't get in the other, and that'll be my path. But it was like that. It was like a toss-up almost, you know?
No, I know what you're talking about. I'd already been through some of the interview processes because I was kind of heading towards pharmacy school, so I knew that game already.
I didn't know it at all. I was new to that, and it showed me where my attachments were, which was good. It showed me what I need to work on, definitely. Go into a little more history. So you went through Bastyr. And then right out of Bastyr, what did you do?
Yeah, so actually, one other detail. When I was an undergrad, the last year I did a teaching fellowship. They actually had an undergrad teaching fellowship with the chemistry department. And it was learning to teach freshman chemistry at the University of Washington. You get your little section, TA section. You have the 300, 400 students in the freshmen, and then they break out into pod groups for labs and TAs. So I got to run one of those. That excited me with teaching, and I went into Bastyr, and a lot of the stuff, some of the biochemistry stuff I was able to actually skip through because I had a lot of that passed over through my undergrad. And we went through all, as you know, all the rigors of basic science. And then we started adding all the tools to our toolbox, like you said, with botanicals, nutrition, and advanced nutrition, advanced diagnostics. And so after Bastyr, I decided I looked at a few residencies. At the time, they were mostly at the schools. And I think they're a great opportunity, but also if you've been at the school and you've already seen how that worked, I was kind of looking for something a little different. So I decided to do two things. One, take a jump and open my own private practice. Two, join a team at Bastyr, which was a fellowship at the time. It was the Bastyr Integrative Oncology Research Project. And it was a 5-year NIH grant between Bastyr and Seattle Cancer Care Alliance. And I also was doing teaching at Bastyr for their IV department, assisting with that, and teaching the nursing students, actually some community colleges as well. That was kind of the first thing I did.
Were you treating cancer patients right there?
Well, we were doing it at Bastyr, and then I had a couple in my private practice, and it wasn't like in my private practice, as you know, a lot of the times you're not putting it out there like, come on in. It's just you have this attraction with people, and it's all over the place. And if anything, it's gotten worse as you've seen these days. So they're automatically coming into the practice, and a lot of the people that we saw at Bastyr Integrative Oncology were actually from Seattle Cancer Care Alliance, and for them to participate in the study, they had to send us patients. So what would often happen is we get the stage 3, stage 4, we got nothing else to do for you. Go see these crazy guys up there and see what they
Yeah.
can do for you. And that was a majority of the people we were seeing up there.
So the reason why I asked that, I was going to say, were they healing, some of them, or what was the situation with those patients? Were they getting better? Or were they so far they were too far, so hard to bring them back at that point?
Yeah, you had a small subset of people that were looking for something different. Like they wanted to start integrative therapies with conventional therapies, but a majority of the people were the ones who have already gone through multiple rounds of different conventional treatments. So they went through radiation, chemo, and they were kind of on their last legs. Like they knew they were very toxic, and they knew this wasn't working anymore, and they really didn't have an answer. And they were giving up on some of them. Like, hey, go to hospice. We don't have anything else to do. Those types of situations on most people, or a very complicated case where that when you go to your oncologist, the prognosis is very, very slim. Those are the types of people that we were getting up there.
But do you think that if they'd started earlier, like maybe stage 2, or even from the beginning, that what you guys were doing and the Cancer Care Institute were doing would have helped them?
Absolutely, because now that more and more of those people are actually doing that, they're looking for other answers before they go to the harder hitting stuff. I see in my own practice and many other practices that I coach and work with that if you can get them before they're going in for these types of treatments, you can slow things down, you can improve quality of life. And if they are going to go into conventional treatments, they just tolerate it so much better and your outcomes are so much better, which is the beauty of doing it first versus waiting until you've been kind of thrashed in the conventional system.
Well, once you have chemo and radiation, your body's so incredibly toxic, your immune system's burned out, your mitochondria are burned out. I mean, you have no energy. And as we know, even the last 3-4 years, it's all about energy. And if you don't have enough energy to even fuel the body to do anything, you know how they used to tell us you need to meet the patient where they're at? And if you had a really sick person and you even showed them the sine wave from the machine, they'd be like, no, I don't. They would go completely away from you because there's so much autoimmunity and so much inflammation that you just touch them and it's painful. So even think about a sine wave, a low sine wave. And then about a month later or so, you do 3 or 4 regular treatments of hydrotherapy, they're doing the sine wave like buzzing right along. There's no problem. But if you come at those guys with these big guns or after the big guns for 2 or 3 months or to give them like 20, 30 sessions, they're going to end up like that. But you would have to bring them back up first and then start to treat them. But I don't think this is understood in conventional medicine, or they just don't have the time or the money or want to do that. So that's an issue, something we can do very well.
Yeah, I think it's part of it, like you said, is not having the time and not wanting to integrate that. I think there are some places that are looking into it because they know that, I think with the insurance dynamics changing, they're looking for other avenues. And then there's other places that are more open. Some of the newer generation or the really old oncology docs that I would see, they would some of them would get curious and say, man, this person's pretty vibrant for what usually would happen with most of my other people. What are you guys doing over there? And, they've seen everybody and they've been through it and they've seen, unfortunately, a lot of loss. And so they're totally open when in that situation. I think those are the two dynamics that have helped kind of gain some momentum in the industry. But I agree with you. We still lack that common need of integrating these therapies in, because a lot of our patients, they get into the system and it's just like a factory, and there's no support outside of that, and they're kind of left. They go through treatment and they're so weak sometimes they're like left to die, and it's just a simple thing like, you need to be hydrated, you need some post care.
Totally. It's not that different, and it doesn't even cost that much to do that, but they need the counseling. And we need centers. The whole thing keeps going through my mind. We need these centers. There's one in Florida, and there's a bunch of them around the country, but there's not enough. No. And they're really expensive too, so not everybody can take part in them as well. So that's a big issue. Maybe we should just make this about cancer, so to speak, because I know you have a lot of experience in the natural side of that. So we're seeing a lot of people talk about cancer and parasites. Those two words are going together in a huge way. And you might have even known this way before this last barrage just came out in the last year or so. But do you think that mebendazole, febendazole, and ivermectin will help cancer patients?
They have a mechanism of action that has support. There's no magic bullet out there, so you can't just take one thing and magically it goes away. I call that a miracle, and there's other powers working than just the one thing. It's literally like 5 or 10% of the time I took those one drugs and magically it went away. But there are mechanism of actions on both of those drugs that do have some incredible benefits in biochemistry of supporting cancer. The bendazole drugs have some effort in like mTOR and IGF-1, which supports, slowing down cancer, how it metastasizes, along with, like you commented, if the person does happen to have some worms of some kind, that's really where the bendazole drugs shine. So there's that mechanism. Ivermectin has many different mechanisms, from as an anti-inflammatory to, as you mentioned, an anti-parasitic drug, and then it also has other mechanisms to supporting and regulating the immune system. So they do have, but multiple ways of helping people. They're not the only drugs that are out there. They've just recently, I think they've gotten the most attention, but there are tons of drugs out there that we use in integrative oncology too.
The reason why I bring those up, and I don't know all the stuff you guys know because I don't really get into the pharmaceuticals or the off-label or the gray areas for cancer. I mean, I know some of them, but what the research or what people have been saying, at least the Germans, and this is obviously, it's social media, so how it looks legit, I don't know. These parasites are almost the basis of what tumor is. It's in like every hard, not blood cancer, but every tumor, there's almost always a base of some kind of parasites, whether it's in that tumor or in the body. And they're making some big leaps. So that's why I wanted to see what you thought about that.
I think it's a piece of the puzzle. So it's like you're looking at a pizza or the terrain of the individual, because some of them we also know the fungal theory too, like especially with prostate cancer is another one. We have fungus in the body or yeast in the body also contributing to cancers. And then we have a lot of viruses out there that do it. So I definitely think it's a piece to the puzzle, but it's not the only thing.
So they're just weakening the immune system, basically like a fire drill. They're like all these false fires all over, like allergies and everything else. And what we do is we clean up all those and get the immune system working a fighting force again, give them thymosin alpha-1 and give them some amazing things. Then they start to beat the cancer. The body does it itself, not relying on these outside entities like so many.
Correct.
Okay.
And
Yeah.
that's exactly why a lot of people, when they go through conventional medicine, they go through their chemo or their surgery, and then they come out the other end now that their immune system's been beat up along with the cancer. And you know, the conventional guys, we cheer, we ring the bell, oh, you're cancer free, and then what happens most of the time? It's back in 6 months to a year. It's because you did nothing for the immune system.
They say cancer cure is 5 years. When they say cancer, when they don't say cure, remission, or you're set, I don't know if they tell the patient, but all they're talking about is 5 years. That's their goal.
Yeah.
And then they get another kind of cancer down the road because they're so toxic and they didn't detox. I mean, I have come into my patient and I say, you're glowing. Look at your history. Look at the chemo. Look at all the stuff. Don't we think we need to detox and get some of that out of you? And some of them will say, of course you do. Others will say, no, I don't want to do all that. That's too expensive or whatever. I feel fine now. My cancer's in remission. My doctor says he got it all. That's scary when I hear that.
Well, that's on top of all the other stuff they've been working on throughout their life, all the other toxic materials they've been accumulating.
We got a lot of work to do, and we got to take these patients step by step, lab by lab, really look carefully. I mean, we just started doing the Vibrant, the one where there's the big tox one where it measures all the mycotoxins, environmental toxins, heavy metals. And they give them a really good price. I think it's $500, and it's like 50 markers. And you know how many people I'm seeing come up like, no, there's no mold. Oh, we never had mold in the house. We don't have any water. Like 5 mycotoxins. And then you look at the autoimmune, and one guy's all his collagen in his body is being attacked. Type 2 collagen. He could barely walk. He's in so much pain. And then another thing, and the endothelial layer is being attacked in his coronary arteries and his heart. And they're like, whoa, look at this. You could enumerate. You could see perfectly what's going on. And we need to, fix those things, obviously.
Yeah, I would even add to that I've seen a lot of people where they're coming in with arsenic, uranium, radon levels, lead, everything off the chart because of what's in their water supply or food. You know, I can do a tap water search and I'm all of a sudden I'm like, man, your radon and arsenic are off the charts in your area.
Just in the tap water, huh?
Just in the tap water. So every single patient I see, literally in my history, I will type in if their zip code and I will see what the environmental working group will display as these are high in their tap water. And most of the time you're going to find very high levels of carcinogenic material in your tap water.
So, because most people filter their water, although even if they don't put a filter in where it's coming in from the outside, then the shower itself is going to be toxic every time, right? And when it's cold, you're going to steam up the bathroom and you're breathing it all in. So that's what you're talking about?
So it's not just drinking it, it's bathing in it every day too.
Wow. Maybe I'm going to stop this interview soon. I didn't know we had so much work to do. You're hitting on stuff I guess I know, but I didn't really think about that carefully. Thank you.
Another one is like Superfund sites. How many people know that they're living on a Superfund site? Like, did you know part of Scottsdale actually has an asbestos Superfund site on it?
Wow. I didn't know the Love Canal in New York. I remember that one. That was a huge one. Yeah.
And radon, and then the newest thing that it's just tragic is all the microplastics.
Yeah, what do they do? I don't even know what they do. Somebody asked me, can you measure my microplastics? Do I have any in my body? I don't even know what the lab is, actually. Is there a lab?
There's only 2 labs that are currently commercially available. One is actually from a fertility group. It's actually a semen analysis. And then the other one's a blood spot. But the problem with these tests is we're finding a lot of these microplastics, they lodge themselves into tissue, specifically where you have inflammation. So you'll find them in like the carotid arteries, the heart, your knee. So the blood test may be missing most of it. Just like you and I test for like lead, we have to provoke it out. We're probably going to miss it when a commercially available lab comes out unless we can figure out how to provoke it away from the tissues. But it is a massive problem.
How bad is it? I mean, what are the symptoms? What's it causing? Do we know yet?
We, in the last year and a half, we have had papers linking it to increased lung cancer and colorectal cancer. We also saw a paper by Nature come out just a couple months ago that said that we had a 50% increase in the last 8 years in the healthy human brain of microplastics. And what they're doing is they're just like we talked about earlier, they're increasing inflammation and reducing the immune system's ability to function properly in those tissues. It's like the next frontier in environmental medicine of, oh my gosh.
Yeah, but we don't even really have these old frontiers fixed yet. We got something new coming already. Man, we're going to have a lot more to learn. That's fine with me, but I just want to know how to get it out of them gracefully so they don't Herxheimer and have all these symptoms and, they get upset.
A lot of it is getting the lymph moving. That's where a lot of it gets
into. Yeah. That makes sense.
And also being cognizant of putting it in your body. I didn't know this until more recently, but most of our microplastics, we could drink them like plastic bottles and using plastic containers, but the number one largest source of microplastics is our clothes. It's the polyester in our clothes.
So, but if it's 100% cotton, that can't be in there, right? Or is it in there too?
It's not in there. It's if they're adding the polyester stuff in there. It predominantly actually comes out when we wash our clothes in the laundry. We have, on average, I think I saw a study, it's 700,000 microplastics per load of laundry is released.
It's released from the water, and then when you put it on, it releases into your body because you washed it?
It's released into the water supply. That water from the washer has to go into the sewer, right? And then has to go somewhere. So you have a water supply. And then when you have it in the dryer, all that lint stuff, that's just airborne microplastics.
You mean that vent that comes right out underneath my window in my house, and I can smell the sweet smell of those plastics, whatever those dryer sheets are that are carcinogenic also?
Well, then you have those too, right?
Oh, man. I'm going to tell my roommate, I'm going to shut the vent down. I'll put it off to the side or something. That's crazy. Let's get on a more positive note if we can. So, what do you see the future of cancer treatment being? And I want you to think about this carefully. So we have many, many different things. We have shockwave therapy, we have PMF, we have so many energetic systems now. We have machines, we have nutraceuticals, we have peptides, there's like 20 groups of treatment. What do you see it? And I know it's hard to say and every patient's different, but the medicine of the future, according to you, what would it be like, at least for cancer?
Everywhere that we're shifting, and you're even seeing it with the conventional medicine group, is immunotherapy support. It's how do we support the immune system to attack this cancer? And the other piece of it is how do we reduce the toxicity of the body, I think are the two biggest areas in the future of oncology. There's no one tool. And the beauty of our medicine, as you know, is we have tons of tools. It's just, I think the biggest thing of why a person's successful working with a cancer patient or unsuccessful is a proper evaluation and then trying to work on those specific areas that are priority in the case. And so is it their immune system? Is it the toxicity that's the biggest issue? Is it a circulatory problem? If it's a circulatory problem, then using things like shockwave and hydrotherapy and stuff are excellent for this. If it's a toxicity problem, we have a different way of approaching that. If it's an immune problem, we have a different way of approaching that. And I think, peptides are one of the things in the future. I think we can engage the immune system and engage different toxicity. It has a plethora of directions using these signaling molecules. I think they're going to be a huge tool. I still believe IV therapy, nutritional therapy, which is my expertise, is also a ongoing massive tool in this industry. And I even use a lot of ozone therapy in my practice as an immune modulator, and I find it's huge there. And the final thing I'll add is I think there is a lot of people talking about photodynamic therapy or light therapy to enhance other therapies. I think that is a massive area to use as well.
Well, let's talk a little bit about IV therapy. That's your specialty. What IVs are you using for cancer now? What are your most efficacious IVs? Ozone, you said, is one. And you have some herbal IVs too? Or
I think the safest one and the most research we see, as we saw just a couple months ago, there was a study that was published with pancreatic cancer and IV vitamin C and doubling survival time when it was used in conjunction with Gemzar, a chemotherapy. We still use a lot of vitamin C therapy high dose in our practice. I always synergize it as much as possible with an herb called artemisinin, or wormwood is the common name. It had a Nobel Prize a couple years ago for its use with malaria, infectious issues, and immune modulating properties too. And that's one of the herbs that you were talking about. And it's harder to get. Used to be pretty easy, and if you step outside of North America or the US, it's readily available in medicine all over the place. It's just this country that's it's compounded, right? By one pharmacy does it. And that's the sad thing about it. The thing is the public should know
Oh
that
yeah. Oh, yeah.
our tussinate, which is the drug which is available outside of our country, it is approved in the United States. It has an approval for use in the United States.
For
If you look
cancer?
up, not for cancer, but it's an approved drug. It's available as, if you look at IND or the drug database, it's there, it's approved, it's just not available.
And that's just made from that herb artemisinin, right?
Correct.
Okay, interesting. So are you doing any curcumin IVs?
I do use curcumin as a synergist. The current curcumin that's in the United States is different than what we used to have. It's actually it's in a molecule called cyclodextrin, which is imagine a structure that looks like a donut, and it holds the curcuminoid in the middle. It works great for autoimmune inflammatory issues and low dosages, but if you're trying to use it very high dosages, it just doesn't liberate the curcuminoid molecule rapid enough to be a single therapy for cancer. You could use it in conjunction with other things in low dosages. But the other one that was available that myself and Dr. Anderson probably used the most of when it was available in the highest dosages, it's not readily available in the United States anymore.
Well, there's some problems with that. I know a while back, and I remember seeing an Ayurvedic doctor interviewed about that, and he said, well, his thinking of this is you can't take such huge amounts of it and put it right in the vein. It's not meant for that. That's what he was basically saying through, if you look at specifically the uses in Ayurveda.
I know Ayurvedic, and they'll do it that way, but I'll tell you, when we used it in high dosages, we saw some pretty phenomenal things with a lot of gallbladder, pancreatic cancer patients when it was the emulsion form. And the reason it's not available in the US is there is a pharmaceutical company which has a patent on it in phase 2 trials for lung cancer and heart disease right now. So they're planning to make some money off that form of curcumin.
Oh, I'm sure they are. Yeah, a lot of people are going to suffer until then. That's terrible. Or if it even works. I know you can't say like exactly how you're going to treat a cancer patient because you don't have somebody in front of you, but can you go a little bit more well-rounded in what you guys are doing and the success rates you have? And if they didn't come in on chemo and radiation, would the success rate go up a lot with what you're doing?
The first step, it's really, so here's one thing I'll say. There are places around, I think, the US and the world that try to make claims of their success rate. And I think some of them are bold claims to make, because everybody's cancer is different. Even though it's breast, or this person has breast and this person has breast cancer, they are different and they're treated differently too. And so this, depending on the stage a person comes in, depending on where it's been located, for an example, if I have a person coming in, it's very localized, early stage, and then they do get, say, a biopsy, or they get an image result. There's criteria we can figure out of how aggressive this is, and if this is something that we need to use both, or is this something that we can use natural therapies up front. One of those things I look at is called the Ki-67 score. It's an easy thing to get. It's an easy thing to ask for. If you don't have it on a biopsy report, you need to ask them to do that. If you have a Ki-67 score over 25%, that tells you this thing is aggressive, and natural therapies alone may not be fast enough or strong enough to control this thing, and you need a little extra support. You get a Ki-67 score below 25%, now your chances of using other therapies as first line is huge. And I think one of the things that we fear when we get that diagnosis of cancer, we think, oh my gosh, I got to get this out right away. I got to carpet bomb it. And the prognosis really doesn't change if you wait 6 to 8 weeks and prep the body. It really doesn't do that. So this rush to get in and cut it out or chemo the person without prepping them is kind of it's the machine versus do we have to do this? We don't have to do this. The prognosis is not going to change if you wait a period of time. So you have time to establish kind of what does the terrain look like of this patient, and can I try things first and see if I can get them to shift, or are they too far gone? I would say, depending on what you're hitting, if you get an early stage, DCIS, stage 1, very controlled, and they don't have an entirely
Well, you're
messed up
talking about
terrain,
breast cancer now? Breast cancer? Okay.
breast, colon,
Right.
even ovarian. I've seen stage 1 where literally they were able to, they decided to cut it out, and all they did was vitamin C therapy, diet, lifestyle changes, and they never went through chemo, radiation, and it never came.
How many years out do you know they're still well, though?
The breasts that I have in my patient that have been stage 3, stage 4, the longest ones I have that have not had cancer come back are 15 years. And the thing with breast cancer that scares me is, even though you've treated it, even if it's a really low grade, if you went through standard of care, it is the one that will return at 10 years if you don't monitor it and do things. And so in our clinical practice, the ones who have been with us for 14, 15 years, they're constantly getting monitored with terrain labs that are looking at their biochemical parameters. They're constantly getting monitored with liquid biopsies called circulating tumor cells to see, is there any trend in their tumors coming back? Because every day you and I have tumor cells in us, but our immune system thankfully works to keep them from becoming a tumor. But if that needle goes up too high, eventually it becomes cancer, right? So we can watch that over time. And a lot of these patients, when they're 10 years out, they're not getting scans. They only scan them for a couple years. The beauty, I will say, though, that we do have now in medicine with proactive medicine is we do have companies that are now offering non-invasive ways of screening. So even at 10, 12 years, we can do an MRI without contrast dye, and we can add that to our picture with our liquid biopsies. So we have a lot more powerful tools of kind of keeping on people. But I think the most potent thing to have success once the cancer is gone is having some long-term relationship with a practitioner who knows how to look for and how to prevent it from coming back. Because this is not a one and done type of disease like any chronic disease.
What about thermography? Do you think that's efficacious? And as long as you get a baseline right up front, you do another one 3 months, 6 months, maybe 1 year, see if any hot spots or anything's growing?
I think it's a great tool to use. I won't use it as my only tool, but among the many of the tools I'll use, it tells me if there's inflammation in the tissue. And if there is, I'm concerned. And I got to figure out where that inflammation is coming from. The thing that I can't rely on at 100% is there are some forms of cancer out there that are not inflammatory in nature. So the tool that I like the most right now they're called a QT scan. It's like, by far, this is probably the most amazing thing ever. It's the woman lays down, and it's an ultrasound that takes a 3D picture of the breast. So there's no compressing, there's no radiation, there's no MRI dye. I'm really, really encouraged about them, and they're relatively new on the market, but they got a lot of good studies, and I've done quite a few women where they had gone through the thermography, the mammography, the MRI, and they still are like, I don't want a biopsy of this, but we don't know what this is. We don't know what this is. We don't know what this is. And I sent up her QT, and they're like, yeah, it's a benign calcification.
Oh, wow, really? So it's that good, huh?
It's that good.
What's it called?
QT scan. There's
Q,
not a
like
lot of, yeah,
QT,
like
QT scan?
QT, yeah. And it's beautiful. It's an ultrasound. It's a type of ultrasound technology.
You just order if they have to go to the hospital, or there's imaging centers that do it?
There's only a couple places. It's a new therapy that's growing. So there's one center that's in the LA area. There's another one I know in Scottsdale if you're on the West Coast, but there's a few scattered around the US. It's not at your conventional imaging center. You're going to typically find it in places that are doing a lot of either cancer therapies, or they're an imaging center that is very progressive and they're adding other images.
Excellent. Thank you for saying that. A lot of people will be watching this. I'll start doing that for my breast cancer patients. Appreciate that. That was probably the best thing you told me all day. Anyway, I appreciate it. You never know what you're going to learn on the interviews. I want you to tell the public, but you're doing a lot more cancer than I do. But we still get them. You're right. They are coming in. I never got any before. I was like, I don't really want cancer in my mind. You know, if I get it, I get it. And then recently I started thinking, well, I got to help people. And that thought went away. But then I think that helped people come in. But also because just people are just coming in now. They're getting much more courageous, and they're not so scared, or they just don't want the drugs either, you know?
They don't. And the other thing that's unfortunately why we're seeing more of them is it's just gone through the roof in the last 4 years.
That's not good. Yeah.
I have a nurse that I work with. She works with me. She's worked with me since the Bastyr on Integrative Oncology projects. She works in a conventional hospital in my area. And she said, you know what I've seen in the last year, the amount of cancer in people under the age of 50, new diagnoses, used to be on average 8 a day, is up to 24 a day now.
No, I think this is great. I think it's such a short period of time. You just gave a wealth of knowledge, and you helped so many people that are about to do this, or they're about to do that, or they're about to get this. That's really what I wanted. I have no idea this would happen today. This is so cool.
One thing I'd like to add that's not depressing.
Okay.
You can empower yourself as a patient to find practitioners out there who are progressive in medicine and are treating you as an individual and not a disease. There are those people out there that are trying to make headway in this industry, and you need to find one of those people to work with and understand it's a lifelong journey. It's not just fix your boo-boo and leave. And if you find that right practitioner that works for you, you will be proactive with your health care and you will get through these challenges you're facing. So there is hope. There is hope.
All right. I just want to thank you. You're just a huge wealth of knowledge. I had no idea. I never interviewed. I never really talked to you, but this is really great. Thank you.
You're very welcome. Thanks for having me.
Any day.